Good morning. I'm Efrosini Grania-Klotzas, one of the infectious diseases consultants. In this short video, I'm going to tell you the basics about how to use dexamethasone for COVID-19. This video is recorded on the 8th of January 2021. Please make sure you're watching the most up-to-date version. This is not intended to be an exhaustive presentation. In the next 2 minutes, I'm only going to talk about the basics. This is a major message. Very little is known about this evolving pandemic. Appropriate therapies are either poor or missing. Every effort should be made to enter patients into clinical trials. We run various clinical trials here in campus, including the tactic trials, as well as the recovery trial, and hopefully many others to follow. Dexamethasone is a major COVID-19 severe disease therapeutic. It has been found via the recovery trial that we have participated in as well. It is now known to decrease mortality as well as to decrease progression to mechanical ventilation among patients who already have oxygen needs. This is the only schematic I'm going to show you that comes from the recovery trial, just to show you that dexamethasone fares better compared to usual care. And it should be used on every patient who needs oxygen unless there's a reason not to. So everybody who is at least 18, hospitalized with confirmed or highly suspected COVID-19 infection, who has severe or critical disease COVID-19 as defined by the WHO, in this particular case, saturation of less than 90 on room air, respiratory rate of more than 30, etc., who is not currently pregnant or breastfeeding, should have dexamethasone offered to them. In pregnancy or breastfeeding, alternative steroids can be used as per the slide. One important message is that you should not use dexamethasone in patients who do not need oxygen, as this might be potentially detrimental to them. Another important message is that although the WHO uses 90% as the cutoff for severe disease, we recommend that you start dexamethasone on any patient with COVID who has a new oxygen need. This might include patients between oxygen saturations of 90 and 94%, as long as you realize this is off license. You use 6 milligrams of dexamethasone daily for up to 10 days or until discharge, whichever is shorter. You do not need to give dexamethasone outside of the hospital or in the TTO. If dexamethasone for whatever reason is not available or appropriate, as in the case of example, pregnant or breastfeeding woman, you can use other glucocorticoids at equivalent doses. Just be aware that this is less tested and there is data supporting this limited. Usual glucocorticoids adverse events, as well as hypoglycemia and an increased risk of infections could follow. These rates of infections in patients with COVID are uncertain, but it is a possibility. Watch out for the usual things you would watch out for. Consider giving protection of the stomach lining with PPIs. Do not stop dexamethasone if the patient's care is escalated to the intensive care unit. Complete the 10 days. And as I mentioned before, stop at discharge. You do not need to continue as an outpatient. Some special cases, when patients require corticosteroids for other indications, for example, patients who come into the hospital with corticosteroids because of known adrenal insufficiency or as treatment for asthma, this should not be withheld and sick day rules should be applied where appropriate. Please discuss with the relevant specialty if there is any uncertainty. Patients on maintenance steroids may still be considered for dexamethasone treatment and indeed should get dexamethasone treatment and or sick day rules. Thank you very much for your attention. Infectious disease is always happy to be contacted about specific questions.